Hi there everyone, this is Ryan again, and today we have another segment of checking out some biomechanics. So previously we took a look at the cervical, upper, middle, and lower vertebra, but now we're going to be checking out the thoracic vertebra, moving our way down. So here are some assessments that we're going to be doing. We're going to be taking a look at flexion, extension, lateral flexion, and rotation. Keep in mind that all of these are active range of motion. So once again, we are going to ask the client to go and perform the activity and apply overpressure if we have pain-free and if they are willing to move. So let's get started. So Brian, can you go and put your arms across your chest like this for me? Perfect. And can you go and pull yourself forward? Great. Is this as far as we can go? Any changes with this?
No.
All right, so I'm going to apply a little overpressure. And any changes with this?
No.
Great. And relax. So now we're going to be doing extension, keeping their hands the same position. Brian, can you go and bend backwards for me, keeping your hips still? Great. Any changes?
No.
No? Going to go and apply a little bit of overpressure. Any changes?
No.
All right, great. So now, can I have you do some bending to your side from here? Perfect. Any changes?
No.
So we're going to have one arm stabilizing on his hip and the other applying the pressure. Any changes?
No.
All right, relax. And the other side. Any changes with this?
No.
Perfect. Once again, stabilizing and applying pressure. Any changes, Brad?
No.
And relax. Last one, what I want you to do is I want you to turn your body, but don't turn at your hips. Keep your hips still. So can you turn towards me, please? Perfect. Now for this position, I'm going to use my leg to help stabilize, and I'm going to turn him a little bit further with the overpressure. Any changes?
No.
And relax. One more time, other side, please. Any changes? How about now?
No.
All right, and relax. And that's it for the assessment test. So I hope to see you guys next time. Catch you later. Bye. Hi there, Ryan again. So this time we are going to be checking out the ribs as they are an essential part of the thoracic spine. So the motion that we're going to first be checking on is the first rib. Now to find it, it is going to be hidden underneath the upper traps for a lot of people, so we're going to have to palpate around, sometimes shifting for that structure. Now to find it, we'll first refer down to T1 and then slide laterally, and as we move towards the side, we should be able to find it as we go and palpate around. So during this, we want to check the movement of the first rib. Is it elevating during inspiration, and is it depressing during expiration? So we want some normal breaths, just as Brian is doing. And the most important thing that we are checking for is there asymmetry? We want to check to make sure that it is symmetrical with its movements. And as we can tell, he's actually breathing just fine. So this doesn't suggest any other problems. So we'll follow for a few more breaths. And that's great. So that's it for now. I'll see you guys again next time. So see you. Bye. Hi everyone, this is Ryan again, and this time we're going to be checking for the motion of the rest of the ribs, not just the first rib. So we are looking for two types of motion. For the upper to mid, we're looking for what's known as the handle pump, which is going to be an anterior and posterior motion, as opposed to the mid and lower ribs, which we're looking for the bucket handle motion, which is going to be a medial to lateral motion. So I'm going to be checking for Brian, moving my hands down along his intercostals. So I'm just going to ask Brian to breathe normally. Hey Brian, can you breathe normally for me? Perfect. And I'm going to be moving my fingers down, checking each vertebra. Now as I get to the mid to lower ribs, what I'm going to be doing is I'm going to be feeling on the side over here using the webbing of my hand. Great. So we are checking for symmetry in motion as well as if there is a typical movement pattern. Now, when we're working with clients who are female, we do have to be careful of modesty as well. But it is important to be able to see the movement of the ribs as you're going through it. That's it for now, so I'll see you guys next time. Bye. Hi guys, it's Ryan here again. So this time, we're going to be doing the spring test of the first rib. So what this is we're going to be pressing down on the first rib, and the reason why we're doing this is to check for the quality of the recoil, trying to see that if it has the elasticity and the bounce that we should be expecting of a rib motion. To do that, once again, we're going to be having to find the first rib. Some people have developed trapezius muscles, so we're going to have to go and move it out of the way until we can find the structure. Now, using the webbing of our hand, we're going to catch the first rib and press down on it, and then feeling its recoil back up as we release. Pressing down once again, and feeling the recoil as we release. Once again, we are checking for the symmetry of it to determine if both sides have an equal motion, which they do for Brian. So, that's it for now. I'll see you guys later. Bye. Hi again, this is Ryan. So this time we're going to be checking out the rest of the rib motion. So this is going to be the rib angle test, spring test. And so for here, we want the patient lying down in prone, and we're going to be following the movement of the rib. So starting all the way down from T12, which if we have problems finding it, we can always check for the iliac crest, and move upward until we hit the first bony landmark. So using one hand shifted in the angle of the rib, we have our other hand which is going to apply the force. So applying an anterior force straight down. And Brian, is there any changes? Alright, good. And we're going to be checking for each of the ribs, checking for the quality of recoil, the elasticity of these ribs. So as I'm moving up into it, I'm going to be running into the scapula, and at this point I want to shift over medially closer to the spinal cord and get in that last bit of motion that I can. Once I hit the top, then we want to stay away from the scapula because we can't get that same motion that we are. Now, it's important to be able to test for symmetry of motion. So once again, we're going to be checking, looking for the first rib down here, the first bony landmark, which is the 12th rib. Once again, using our hand to press down, and looking for symmetry of motion. It's important to be applying the pressure through your top hand, as it provides the force needed and protects your biomechanics so that you can keep your body safe while performing these tests on your clients. So that's it for now. I'll see you guys later and catch you at the next test. Bye. Hi guys, so finally this is the last test that we're going to be checking out. This is the passive spring test of the thoracic spine. So for this test, once again we're checking out the quality of recoil for the thoracic spine, but this time we're going to be checking it not along the angle of the ribs, but instead the spinous processes. So for this, we want to use the hypothenar eminence of our hand, the nice thick palm side, and we're going to look for T1 by first looking for C7, and using our hypothenar eminence, we're going to take our other hand to apply the pressure anteriorly. So we're going to be pressing down. pressing down and checking for each of the spinous processes. Now, what we are doing as PTs is that we are assigning a grade for each of the motion. These grades will be either normal, hypomobile, or hypermobile. So normal is as we expect, but hypomobile, which is limited motion, and hypermobile, which is excessive motion. So as we get to the 10th, 11th, and 12th rib, thoracic vertebra, we're going to have to change the angle of it as it starts to change with the facets of the lumbar spine. So we are going to be applying pressure at an upward angle as opposed to a more anterior angle. That's it for now. So I'll see you guys on the next video. Catch you later. Bye.